Hello doctor and medical students, I am Dr. Amit. So today we'll talk about a very common laboratory finding we often find in pathology reports, and increased ESR. We'll talk about what an increased ESR actually mean. We all know that ESR means erythrocyte sedimentation rate. Actually, it measures how quickly the red blood cells settle down in a pipette tube in a laboratory. Now let's understand the mechanism. So the RBC carry negative charge. We often call it as a zeta potential. As we learned in our school that like charges repel. So because of that negative charge, RBC remains separated in a blood. Suppose this is 2 RBC, okay? So both these RBC carry negative charge on their surface. So in a normal conditions, they both repel each other because of the negative charges. But whenever there is an ongoing inflammation in our body, inflammatory called fibrinogen reduces the negative charge on the RBC surface, and as a result RBC start sticking together and form an aggregate called Rolex formation. Now this aggregated RBC become denser and heavier, so they fall at a faster rate in a pipette tube, and this faster sedimentation we often call as an increased ESR. So in normal condition, we often send ESR with CRP, as CRP is a more specific marker for inflammation. Now let's discuss about the conditions where ESR is increased and ESR decreased. Okay, so let's first talk about where the ESR increased. So ESR increase in conditions like anemia. Why in anemia? Because in anemia there will be less RBC, so the blood become less viscous, so the RBC fall at a higher rate in the pipette tube. Then in cases of infections due to inflammation, then inflammatory conditions like giant cell arteritis and polymyalgia rheumatica. In malignancies like in metastatic cancers, then in multiple myeloma, then renal disease like end-stage renal disease, nephrotic syndrome, and in case of pregnancy. Now let's talk about conditions where ESR decreased, like in conditions sickle cell anemia. Why? Because of distorted shape, and so the RBC will not able to form Rolex formations. So the ESR is decreased here. In cases of polycythemia, because there will be more RBC, and more RBC will make the blood more viscous, so it will fall at lesser rate. Okay. In case of heart failure, in case of microcytosis, and in conditions where hypofibrinogenemia, where the fibrinogen is less in the blood. So at last, ESR is a non-specific marker of inflammations. Okay, so it should always be interpreted in the correlating with the clinical symptoms and signs. Okay, so this is all about ESR today. Thank you for listening. Please subscribe my YouTube channel at Dr. Amit Official for more videos on medical content. Thank you.